We are joined now by Dr. Kevin Kavanagh, who is the founder and president of Health Watch USA, and he's a retired physician. Good morning, Doc.
Good morning, Jack.
Good to have you on with us, as it always is. I guess the governor's recommendations canceling in-school building classes until September 28 has drawn some criticism, as you might expect.
Well, yes, I do agree with him, though, that it does not look like Kentucky has the right statistics regarding this infection to have schools open. New York has opened the schools, but they have a much lower infection rate. And something that I found peculiar is that in New York, I believe they still have indoor dining and bars closed. In Kentucky, we're kind of the opposite. And I think that's something we really do need to look at to get this virus under control and put our primary emphasis on opening of schools. I think that this is something that we really need to do. And it's not just getting the infection rate down in the community. We also need to make sure that the school buildings are safe, both with air ventilation and with air cleaning. And that is very, very important.
Now, Governor Beshear's decision to close schools may be triggering a federal law that requires employers to pay employees up to 12 weeks while the employee stays home to take care of their school-aged children. It's FFCRA. Do you know about that act?
I don't know about that. But when you say close schools, they're really just closing the school building. The teachers, yes, believe me, are very busy trying to construct online classwork. So there's a tremendous amount of activity going on. The teachers are not laying idle. So I do think they're going to be working. I know my daughter, who teaches at a university, has been busier than you can't believe, trying to adapt her coursework to online teaching and get that up and running.
And of course, we all have heard that the governor and his wife, Brittany, have both tested negative, but they got up yesterday morning apparently not feeling well and went and had a test.
Well, yes, and luckily they tested negative again. I think he's pretty high risk for picking up this infection. I mean, after all, he's out and about. He has to meet with people, and even though you take precautions, we try to stress on this show that these precautions make you safer, not necessarily making you safe. And there's also the new research which is coming out about aerosolization of this virus, which can occur. And that's one of the reasons why I feel that the buildings need to be upgraded, including our government buildings. And aerosolization is where you get very, very small viral particles that actually can float in the air, and they can live for up to 3 hours. And when that happens, there's a potential for circulating through the ventilation system. It's not felt to be a major mode of spread, but it is a factor. But there are some things that I hear that just send shivers down my spine. For example, one of the schools in Georgia was saying how they were trying to get music classes going with wind instruments. And for me, if there's anything that's going to aerosolize a virus, it's a wind instrument. That's got to be the worst idea I could think of. They recognize there is a safety problem. We're going to sit people that were 9 feet apart. Well, for an aerosolized virus, it can float without wind for some time. That's not far enough. You need to make sure you've got good ventilation, get that air cleaned. And that may be one of the reasons why being outside is so much more safer than indoor activities.
And Russia now has come up with a vaccine. Are you impressed at all?
No, I am impressed about not being very safe. We have stressed many times on this show that vaccine development needs to be done carefully. It needs to be thoroughly tested, and you need to make sure that it is both safe and efficacious. In other words, it has to work. It has to work for some time. You need to have a good immune response, but also a safe immune response. We've talked about the different types of immune responses. Well, there's a particular one you want to get and some you don't want to get. All that needs to be tested for, and patients need to be followed for a particular period of time. And when that's done, you can make vaccines safely. When you rush them for any sort of political deadline, that's a setup for a disaster. So we need to be safe in our vaccine development.
As always, good to talk to you. Thank you very much, Dr. Kevin Kavanagh.
Oh, thank you very much, Jack.